Tim, I am glad you came with Lucy to go over the new medication she will be taking. Lucy, you have been prescribed Novolog for your type 2 diabetes. You will be starting insulin by giving yourself a shot once daily before your largest meal. I know that you may have concerns about using insulin and giving yourself a shot. Do not worry. I am here to explain the possible side effects and the best way to manage them. You may be fearful of the size of the needle. I would like to stress that the needle is very tiny and painless. It is among one of the smallest needles. Your insulin comes in an easy-to-use pen, which is portable and discreet. You can keep this pen in your shirt pocket or in your purse and pull it out when you are ready to eat at your meal. This pen does not have to be refrigerated. Since you have type 2 diabetes, you do not produce enough insulin or your body's cells do not respond to insulin properly, a condition called insulin resistance. You have taken prior treatment with oral medications and your blood sugar is still not well controlled. Therefore, we will need to introduce insulin to your body from an outside source, this pen. Let's begin by explaining what insulin is. Insulin is a hormone made by your pancreas, which is an organ that sits behind your stomach. Insulin is needed to move glucose, the sugar in the blood, into the body cells. The cells then use the sugar in the blood as fuel to do their work. Insulin also helps the body store fat for future energy use. Your body is not making enough insulin anymore. You have been prescribed Novolog, a rapid or fast-acting insulin that works within 5 minutes and lasts 2 to 4 hours. You must start eating within 5 minutes of giving yourself the shot. Remember that insulin injections will lower your blood sugar whether you have eaten or not. Very low blood sugar, also called hypoglycemia, can cause serious problems. Common symptoms associated with low blood sugar include blurry vision, rapid heartbeat, and shakiness. To best manage all 3 of these symptoms or side effects, you must raise your blood sugar back up. To do this, you can eat something with a high sugar content like hard candy or a glucose source such as orange juice. When you start to feel these symptoms, it is a sign your blood sugar is too low and it needs to be addressed. You need to drink orange juice or have a snack. Rest until you feel better. You will only need to take 1 shot a day to start. We will begin with 4 units of Novolog before your largest meal. Each click is 1 unit. 1, 2, 3, 4. Following your diet and monitoring your blood sugar levels will be important in deciding if any future changes are needed in your insulin dose. We will be following this plan for 12 weeks. You will visit your physician so he can read your A1C level, a blood test that measures how well your blood sugar is controlled. Our goal is 7 or lower. If your A1C is below 7 after 12 weeks, we will continue with once daily dosing. If A1C is greater than 7, we will add 4 units of Novolog to your second largest meal using twice daily. If after 24 weeks it is still above 7, we will add 4 units before the next largest meal or using 3 times daily. Eating meals on a regular schedule is very important when taking insulin. Most people do not experience issues using insulin and feel better when their blood sugar is controlled. When using your insulin pen, it should be kept at room temperature, otherwise the insulin should be refrigerated. Novolog is a clear substance that is clear, and if it becomes cloudy, clumped, or crystallized, it should be thrown away and a new pen should be used. If you have any additional questions, you should go to your physician or pharmacist. Thank you.
Thank you.